This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. I'm Dave Wilson. Our guest this morning is one of our friends of the show here, Dr. Shakuri-Rad, urologist, medical director of robotic surgery, master robotic surgeon, medical director of medical specialties at Mon Health. And we're going to be talking about men's health. June is Men's Health Month. But before we get into that, let's just welcome Dr. Shakuri-Rad into the program. Doctor, good morning. How you been?
Good morning. Great, thank you, and good to be with you again on the show.
Yeah, glad to have you. Got any big summer plans this year?
You know, I think my kids are at that age where, we are trying to do a lot of camps and sports activities, and, so I'm going to be running around, supporting them, and I think that's the fun summer for me to do that. I love sports, and so as my kids get more active in these things, I kind of relive my childhood years.
See, you get to tell them how good you were, and they can't verify any of that information. So,
that's a beautiful thing. Back in my days, there was no social media or anything to keep track, so I can tell them, what I want, and they have to believe me.
Absolutely. Well, good to have you on again. Just we've had you. Obviously, you've been on the show several times, but remind people of your background, where you went to school, and how you got associated with Mon Health.
Sure. So I graduated from Parkersburg High School along with my wife, Whitney, who's been with me since high school. We came to Morgantown, went to WVU for undergrad, went to Lewisburg for medical school, and I did my residency training and urological specialty training in Michigan, after which we came back home to Morgantown, and we were looking to be back in West Virginia, and since we loved Morgantown so much, we wanted to, raise our kids here in the state and bring some of the great knowledge that I had taken away from Michigan, bring it back home.
What do you enjoy most about your line of work?
I think the beautiful thing about urology is that we get to really treat patients both in a acute setting, meaning they have a problem that they come to the emergency room with, and we can help them fix it. But also we can go with these patients through their entire life. We are primary care physicians, if you will, for men as well as women, depending on their problems. But we are also surgeons, so we get to go to the operating room, use very advanced technologies to help our patients, and we get the best of both worlds. And that's really what attracted me to urology.
Well, June is Men's Health Month. What are some of the top concerns that men have to deal with health-wise? So
men's health encompasses a wide range of issues, but some of the top health concerns really include cardiovascular disease, that's number one disease in the U.S., diabetes, mental health disorders, and cancers, particularly prostate cancer in men. Men are also at higher risk for conditions like high blood pressure, high cholesterol. So it's very crucial for us men to be proactive about our health and seek regular checkups with our primary care physicians and providers, because they're really the quarterbacks of our health system. They do the screening, they identify any problems that may be there, and then they send you to the appropriate surgeons or specialists that need to take care of those problems for you. So my biggest message for men is always get screened. There are a lot of diseases that if we intervene early, they don't have to become problems later on.
As a urologist, what are some of the common conditions that you see and treat in patients?
So some of the common problems, so urologists deal with the kidneys, the bladder, the prostate in men. And so if you think of it as your plumbing system in the body, and so if you're having any issues with the urination, if you're having any issues with sexual dysfunction, any cancers of the kidneys, bladder, prostate, and so forth, that's what urologists take care of. Now, we also deal with hormone disorders in men, for example, low testosterone. And so these issues are extremely common. For example, prostate cancer is the second most common cancer in men. And so screening for prostate cancer is absolutely vital. 1 in 8 men in the U.S. Is diagnosed with prostate cancer every year. And if we can catch these men early, then we can reduce the risk of mortality. And prostate cancer, unfortunately, remains the second most common cause of cancer-related deaths in men. And that the equivalent to that in women would be breast cancer. And so we really bring our men in when they come in with whatever problem they may have. We discuss all of the men's health concerns with them. Some of the younger men, for example, in our office may be concerned about fertility issues. They may have difficulty fathering children, and we help them with that. Some may want to have a vasectomy for birth control, and we can help them with that as well. So it's a very broad range of issues that we deal with, and we really have a very comprehensive center here.
When it comes to prostate cancer, what types of screenings are available, and at what age should you start having those screenings on a regular basis?
So prostate cancer, it's recommended that we screen men starting at age 50 to 55 with a PSA blood test. The PSA stands for prostate-specific antigen. It's a protein that's released by the prostate and circulates in our bodies. And we measure that on a blood test. And then we also perform a physical exam on men. If you have a family history of prostate cancer, breast cancer, or ovarian cancer, we may screen you earlier. Now, some men, for example, of African-American background, have a higher risk of prostate cancer, and they're also screened at an earlier age. If we detect any elevations in the blood work or any abnormalities on the physical exam, then we guide them through the process of identifying whether or not prostate cancer is present and offer them treatments if necessary.
Dr. Shakuri-Rad is our guest this morning. Urologist, Medical Director of Robotic Surgery, Medical Director of Medical Specialties, Master Robotic Surgeon. With prostate cancer specifically there, early detection, how treatable is that, especially if detected very early?
So prostate cancer exists in two forms, really. There's localized prostate cancer, where the cancer is confined to the prostate, and then there is metastatic prostate cancer, when the cancer has already escaped the prostate gland and has made its way to other organs in the body. If we detect prostate cancer at an early stage where it's still confined to the prostate, there are a lot of great options. We have, for example, treatments with surgery. Robotic surgery is the gold standard for surgical intervention on the prostate. At Mon Health Medical Center, we were the first in the state to perform a single-incision robotic surgery, which allows men to have the least impact on their body while still getting the most benefit of the treatment. We can preserve their urinary continence, their sexual function, using these advanced tools. And they are also able to get back to their loved ones at a very early stage. I do all of these procedures as an outpatient, for example. Now, we have also treatments such as radiation therapy available for patients. There are additional treatments called localized minimally invasive treatments such as high-intensity focused ultrasound. We have cryotherapy available. These therapies each have their own risks and benefits. And when we counsel patients, we want to really focus on individualizing the treatment, and that's what it's all about. I always tell my guys it's about how many tools I have in the toolbox. If you go to someone that has only a hammer, well, any problem that they encounter, they're going to try to fix it with a hammer. We want to have as many tools as possible so that we can apply the right tool to the right patient at the right time.
Dr. Shakuri-Rad is our guest this morning. Much more with Dr. Shakuri-Rad coming up, but we got to take a break. We will continue the conversation. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Talking to Dr. Shakuri-Rad this morning, and we're focusing on men's health. June is Men's Health Month. One of the things you mentioned there in that first segment was low testosterone, and it seems like there are a bunch of commercials these days on television I've seen Bo Jackson talking about low T. I've seen Mr. T talking about low testosterone. What are we talking about, and what are you trying to treat there when we're talking about low testosterone in men?
That's a great question, and I do watch these commercials along with everyone else, and it's always interesting to see what patients take away from these types of advertisements on TV, radio, and the internet. And it's important to understand what testosterone is. Testosterone is one of our main male hormones, and people that are older have obesity, have poorly managed diabetes, obstructive sleep apnea, which we don't think about really when we talk about testosterone, have chronic medical conditions like kidney dysfunction, cirrhosis of the liver. These patients are at higher risk for a reduced level of testosterone in their body. Now, testosterone does a lot of good things in our body. We often associate it with intimacy and sexual drive, but it does a lot more than that. It does control our mood. It controls the ability to burn fat and gain muscle mass. It does help with cardiovascular health, with our bone health. People that are low in their testosterone levels may develop osteopenia or osteoporosis, weakening of their bones. And so when I always recommend to patients to really be in tune with their symptoms. If you feel that you're tired more than usual, and you just don't have the type of energy you had way beyond what would be considered normal perhaps for your age. If you're starting to develop moodiness, developing problems with losing body fat even though you're exercising on a regular basis, those are really signs that, hey, maybe there's something else going on, I should get it checked out. And patients who do get diagnosed appropriately and who receive treatment, they will tell you that they feel absolutely amazing afterwards. Their life is restored, their quality of life is restored, and we have to make sure that you're really diagnosed and properly treated by an individual who is well-versed in this field. A lot of these advertisements on TV, unfortunately, can take you to a path where you get suboptimal treatment, sometimes dangerous treatments. And replacing testosterone to dangerous levels can actually be very hazardous for you. People can develop blood clots if they're given too much testosterone. A lot of other bodily functions can get affected negatively if you're given the wrong amount or wrong kind of testosterone. So being able to just discuss it with your family physician or coming to a urologist certainly can go a long way towards improving your quality of life.
Yeah, I guess the natural question would be, when is, and I guess this would depend on the individual, where's the line between something that needs treated and just the natural progression of getting a little bit older?
That's a good question, and we have, guidelines and we have criteria for that. The testosterone levels, we are able to measure those on blood tests, and there are different types of testosterone measurements, actually. There's not just one. And based on those measurements and based on the patient's symptoms, then we can establish the diagnosis. Sometimes some men actually may have lower testosterone levels, but they're not affected as much as someone else that may have borderline testosterone levels. And so that screening and that blood test really is the first step. And then if we do find a problem, then we can address it. I always tell my guys, think of it as a check engine light. If your car's check engine light goes on, you're going to take it to the mechanic. They're going to pop the hood, take a look, and tell you what's going on, and then you decide on whether or not you want it fixed. And that's very similar when it comes to men's health screening, especially with low testosterone levels.
Visiting with Dr. Shakuri-Rad this morning, we're talking about men's health. What are some of the recent advancements that have been made in men's health at Mon Health?
So at Mon Health, we take pride in really using the latest and greatest advancements in technology and medical science. We have always had a reputation for being first in introducing certain treatments to West Virginia, to north central West Virginia. For example, in the case of benign prostatic enlargement, on an enlarged prostate, also called BPH. We have introduced treatments such as the UroLift procedure, minimally invasive treatment to treat this condition, aquablation, a water-based treatment. I recently performed the first Optilume procedure in West Virginia, which is one of the newest treatments available that's minimally invasive, doesn't cause very many side effects. And so these treatments really are important for patients to have access to. So number one, they understand what's out there, what can I use, and what causes the least amount of side effects. But number two, patients don't want to travel if they don't have to. So they want to get their care locally where they live, and with Mon Health, we can really provide them that access. Another treatment that we have been introducing and have really excelled at is sacral neuromodulation, where we introduce a small battery that can control bladder functions for patients who have urinary incontinence, for example, or fecal incontinence. And we were recently named an Axonic Sacral Neuromodulation Center of Excellence here, and we are the first in the state.
We got about a minute and a half here, Dr. Shakuri-Rad. What do you want men to take away from our conversation today?
I think men need to simply, us men, we are very stubborn. I always tell my men this. We're stubborn. We don't want to admit that there's something wrong, and we want to really hold off on getting care until it's so bad that our spouses or significant others or family members take us in. And so it's important that we stay healthy so that we can take care of our families, that we can be around our families. And so the first step is always, if you feel like there's something wrong, just ask your family physician, ask a medical professional, and get the screening done. The screening is really simple. It usually involves a physical exam, may involve some blood work, and then we can see if there's something wrong. And if there is, if we treat it early, then you don't have to go through a lot of procedures or treatments that are going to negatively affect you. Early is best. And if and get out there and talk to other men in the community, about your problems. There's a good chance if you're dealing with something, another guy has also dealt with it or is dealing with it, and they can tell you, hey, I went to so and so, and it's not really that bad, and we can really become a support system for each other.
To see you, for instance, a urologist. Can men just make an appointment? Do we need to have a referral from the family physician? How do we get in contact?
I would say both. We really allow access to us here. It's very unusual that we do allow some patients to come and see us without a referral. If you go just simply to monhealth.com/urology, you can fill out a form that allows you to either get an appointment, or if there's a referral required because we need maybe some blood work to make sure you're in the right place, then we guide you to your family physician, and they can send us a referral. But access is really broad, and certainly if you have a question, concern, you can always go online, give us a call, and we can take care of you.
And I'll throw this in because it seems like we throw this into every show because it's universally applicable. Get some exercise, watch what you eat, and if you smoke, quit. And if you don't smoke, don't start. And that's going to have positive impacts on your overall health.
Absolutely right.
Dr. Shakuri-Rad, always a pleasure to spend some time with you. Appreciate you taking today and visiting with us today.
Thanks for having me again. Thank you very much.